Mr. Chairman, I want to acknowledge Senators Burr and Bennett and thank them for their efforts on the Drug Supply Chain Security Act. I want to express my very strong support for this legislation. As stated before by my colleagues, today the committee is releasing a bipartisan report. It shows you what we can do when we act in a bipartisan manner related to what we know about compounding pharmacy and the meningitis crisis, as stated by my good friend and colleague and the ranking member, Senator Alexander. This report details a shocking failure to act. A failure to act by the New England Compounding Center, failure by the Massachusetts Board of Pharmacy to pull the license of an entity with repeated compliance issues, a failure to act by the FDA to see beyond the bureaucracy and red tape that defines them to use the authority they had, or at a minimum, share the information they possess to protect patients and public health. And a failure to act by Congress, who has recognized the lack of clarity on these issues for over a decade and could have potentially averted this crisis. I've been working with Senator Burr for years to gain real momentum on these issues, and now, through the leadership of Chairman Harkin and Ranking Member Alexander, along with Senator Franken, we are putting forth legislation to address these failures and ensure the real clarity in the future to avoid another crisis and put patients first. Status quo is unacceptable. For those who say we're not going there, we're going there. Saying that the current law under 503A is satisfactory or preferable to anything we have done in this legislation is nonsense, because under that construct, in one instance, as has been stated many times, 55 people have lost their lives, over 700 who have become ill, and as Senator Alexander pointed out, in other parts of the country as well. Not only this is not the only occurrence in the last 10 years. Our efforts on this legislation are supported by a wide range of stakeholders, including the Premier Healthcare Alliance, the Council on Radionuclides and Radiopharmaceuticals, that's CORAR, the American Society of Health System Pharmacists, the Pew Charitable Trust, the National Association of Boards of Pharmacy, and the National Association of Chain Drugstores. We acknowledge there are some things we still need to address as the legislation moves to the floor, and appreciate the willingness of the full committee to work with us on this legislation. We have the momentum, and we need to move forward to get this done and finally pass this legislation. Thanks again to the chairman and the ranking member. I encourage my colleagues to continue their support of S959, the Pharmaceutical Compounding Quality and Accountability Act, as we move to the floor. Thank you, Mr. Chairman.
And thank you, Senator Roberts. And again, my thanks to you for so many years of focus and not giving up on this issue. Appreciate it very much. And it's finally got something done, but I know you've been on it for a long time, and I appreciate that very, very much.